on God's lips. Yes. I'm not going to advance for vacation.
Welcome and good evening, everybody. Thank you very much for joining us today. Special welcome to those of you joining us from Elim Gospel Assembly Men's Group. We'll kind of launch off today with our usual. Jamaica Broilers is a big supporter of ours, and we have a montage for them. Continue to send out a link.
You've tamed the voices in your head. You've put your courage to the test. Laid all your doubts to rest. Your mind is clearer than before. Your heart is full and wanting more. Your future's at the door. Give it all you got. No hesitating. You've been waiting all your life. This is your moment. This is your moment in time. This is your moment. This is your moment to shine, to shine, to shine.
All right, we want to thank again Jamaica Broilers for their continued support to us. Today we have a good thing going on. We're talking about men's health and mental health and general health in general with men. So what I want you to do basically is send out the link, share it with individuals. We're expecting of individuals from the Elim Gospel Assembly. Welcome if any of you have joined us. It is very, very good to be here and good to have you joining us. Okay, remember, send out the link. Let your friends know this is going to be a good run. Today we have with us Dr. Jevon Samuels, who is a very educated young man, BSc, MPhil, MBBBC, esteemed medical doctor with over 10 years experience in the medical field. He studied at the University of the West Indies, where he obtained a bachelor and master's in chemistry, as well as a bachelor of medicine and surgery. That means he spent a long time studying. Dr. Samuels also pursued studies at the University of Gothenburg, Sweden, and he's going to introduce himself in Swedish, maybe. He currently works at the Kingston Public Hospital in the internal medicine department. He also owns and operates his own private practice at 40 Cassia Park Road. If you're looking for a doctor, you can check him out. He recently started a podcast on YouTube called In Office with Dr. Jevon Samuels. On this podcast, he discusses life, sickness, and death with informative medical concerns. He's married and has 2 beautiful children. Dr. Samuels, welcome. How are you today?
Mr. Martin, thank you for having me. Yatala Baralita Shangska.
Yes.
Yes, I said I speak a little bit of Swedish.
Well, no, say that again. That was too fast.
Yes. Oh, okay. Yatala Baralita Shangska.
You know what is the irony of life? Is that you sound like a Jamaican talking in the country.
Yes.
until you really tune in and realize, oh, wait, it's not English. So I'm gonna hand the stage over to you, sir.
Okay, thank you
Remember,
very much.
those of you, as we go along, if you have any questions, please put it in the chat, and I will field them for Q&A afterwards. So, Dr. Samuels, the stage is yours.
Okay, sure. Okay, Mr. Martin, I received my full screen.
Yes, sir. We're good to
Okay.
rock and roll.
Okay, all right. So, good day again, everyone. So, as Mr. Martin said, I'm Dr. Jevon Samuels, and today we'll be presenting on a man and his health. And it's my pleasure to present on a man and his health because I'm very passionate about men's health in general, health overall, but in particular men's health because, as you know, men tend to not seek medical attention as early as they should, right? So the biggest challenge that we're having with men's health at present is that they just don't go to the doctor often enough, or they just go too late, all right? So this month, June, is Men's Health Month, and we're going to just use this month to continue the promotion of men's health and to look in the different aspects of men's health that we have currently going on and what we are seeing to be good improvements and what are still below what we expect from the general public. So it's always a pleasure to be a part of health promotion. Now, if we take a look at this graph, here is a graph on life expectancy. I don't mean to get too complicated, but I just want to show the general trend that in general from 1950 until present, life expectancy of females outnumber is way higher. It's at least 5 years higher than that of males, right? And apart from men have take part in more risky behavior or occupation that are higher risk of endangering their lives, it also has to do with the health-seeking behavior of male, right? And actually lifestyle choices in which we will get into later in the presentation. Now, if we take a look at this graph, it just this diagram, just a simple healthy lifestyle diagram in which we looking at the different aspect of health, excluding the medical checkup. So if we take a look in the top left hand corner, it mentioned about diet. So we must try and drink as much water as possible, unless you have like contraindication to plenty water, such as persons that might have end-stage renal disease or persons that may have like heart failure issues. So we do have different illness that could technically have that a lot of water may be bad. But in general, for a normal person without any chronic illness, drinking plenty water and keeping hydrated is a part of good health. Also, eating a balanced diet. When we talk about balanced diet, a diet which is rich in fruits and vegetables and also natural foods. So we're talking about ground provision, whole meat, and less processed food, less fats and oil. All right. Now we can move on to exercise as well. It's just amazing that exercise is very important for health overall, right? Especially men's health, because as we know, men tend to want to have like good sexual health, and we know that exercise help increases the body's testosterone, the strength of the muscle, and the whole cardiovascular system that we will spend a lot of time in this presentation and as well. Also, in terms of meditation, is also important for good health. Also, get enough sleep. When we talk about full sleep, we're talking about 7 to 9 hours of sleep per day. And on average, because of our busy lifestyle, men more so than females tend to be getting less sleep, and that is actually contributing to actually poor health. Also, this is a Christian organization here, so positive thinking like with godly principles, religious lifestyle, those are normally lifestyle that encourage positive thinking and actually let persons be a little more fulfilling as well. I put some additional thing here, graph here again is biased to talk about relaxation, but in general, other stuff that persons can do for relaxation to decrease stress levels would be like to listening to music or doing whatever sport they may like, right? And here, fun activities like traveling. However, when you talk about traveling, it does not necessarily mean you have to be taking trips overseas, but also it could just mean like even exploring the country that you live in. Now, let's move on to the routine general checkup recommendation for men at different age groups, right? So as we can see here, look at the first, like the 20s, you can see that like general checkup on a regular basis every year, every 2 years for a normal healthy male in the 20s would be like to get general examination, like the physical examination by a physician, including the blood pressure screening and other vitals. So they could do like also do like urine tests, because even at that stage, you know that even if you should go and do a medical for school, some tests like the urine test is very essential. So I want to educate general public, sir, because sometimes some of these persons normally will show up to the doctor for a different illness, but in general, sometimes the doctors may be a busy clinic and probably just focus on the pathology that they come with and ignoring the general screening of a male, because the place, the health center or the clinic may be busy, and we are probably just treating the illness that they come with and not doing the general screening. But also, as you go in the 30s, 40s, you can see that we normally include more tests, like they check the cholesterol levels, the screen for diabetes, especially if you have a family history of diabetes, right? And 40s, 50s, additional screening tests that you have available now is like the test for like colon cancer. So sometimes in the male executive profile, we test for the fecal occult blood, in which is a part of the general screening for colon cancer. We'll talk about prostate examination in more details, and we'll look at prostate cancer and prostate disease in general. And also, in some facilities, they might be chest testing for bone density tests and for abdominal aorta aneurysm, which actually just in elderly male, it becomes a issue in which the main blood vessel in the abdomen may be enlarged. All right. So here we are looking at a diagram which showing the leading cause of death in male, right? As we can see, 32.3% are, that is 1 in every 3 male that dies actually die from a cardiovascular disease, right? So even though when we talk about men's health, some persons might be focusing on the men's sexual organ like prostate cancer or erectile dysfunction, etc. In reality, in terms of improving life expectancy of male, we should actually focus on the cardiovascular diseases such as the heart disease, stroke, and arterial disease, etc. Right? Cancers actually account for about 1 in every 5 male deaths, and we know that the burden of alcohol and cigarette smoking among males actually put us at increased risk of getting different cancers, right? And other causes that we look in more detail further on respiratory causes, diabetes, and lower respiratory tract infection. So as I had mentioned before, cardiovascular diseases such as heart disease, stroke, etc., is actually lifestyle diseases. So these are actually preventable cause of death. So even though it's the highest cause of death, most of these diseases are actually lifestyle disease in which came because of lifestyle such as obesity, lack of exercise, smoking, stress, etc. Now, high on the list for cardiovascular disease is hypertension, because actually a very, very common illness, hypertension, and it's one of those illnesses that we call a silent killer, because we often don't have any symptoms when someone has high blood pressure. It's actually we have to test actual volume. So normally when I'm doing this presentation, I just have at least a slide which just remind the general public that normal blood pressure is 120/80 or less. So that's when we talk about know your numbers campaign and blood pressure, we definitely encourage everyone to have an idea of what is normal blood pressure. Because blood pressure is not something that, oh, you necessarily have to have a headache or necessarily feeling sick or having the symptoms that you need to present. High blood pressure is normally mainly diagnosed from your general checkup at a physician, right? And high blood pressure is not something that should be taken lightly because of the severe complications that can result from high blood pressure. But before I talk about the complications, we can just look at some of the risk factors for developing high blood pressure or hypertension. So the general bad habits that mainly more male than female with also tend to have the smoking, both cigarette and also smoking of marijuana is actually high on the list for males, which actually let the blood vessels increase the tone in the blood vessels and cause the hypertension. In terms of diet, high salt diet, so we tend to cook with a lot of salt to increase flavor and taste of food. But actually, a lot of salt will have, but mainly a lot of sodium, and it causes high blood pressure. Also, lack of exercise, obesity, and the side effect of some medication, even common over-the-counter medication, put us at risk of getting high blood pressure, such as even like Brufen, which is Advil, which is an over-the-counter medication. Excessive use can actually put us at risk of getting hypertension. Now, why medical persons stress on hypertension and to control the blood pressure even though we don't have any symptoms when it's at early stages? It's a silent killer, as I said before, so it has a damaging effect on basically all the organs of the body because it's damaging the blood vessels, so it damages blood vessels near different organs and hence lead to different complications. So like if it damages blood vessels in the brain, it can lead to stroke, confusion, headache, etc. Can damage the blood vessels in the eye, causing blindness, and also can lead to heart attack, heart failure, etc. Also kidney failure as well. All right. And as we will discuss later on, it's actually one of those risk factors that is high on the list for erectile dysfunction, and which is normally one of those illness that a male will develop, if a male develop, will definitely seek medical attention. Now, in addition to hypertension, diabetes is also a very common vascular or metabolic disease in general. I'm not necessarily saying that diabetes is more prevalent in male than female. However, where we have the difference with diabetes is that statistics would have shown that even though we have a similar percentage of male and female who have diabetes, that male tend to not do as well in terms of managing their diabetes, and hence the chance of men dying from diabetes actually probably about 30 to 40% higher than that of females. Right? So we are seeing a simple illness such as diabetes. Well, not simple, but a serious illness like diabetes. Just different medical practices in general would result in far better outcome for females in comparison to male. And once more, diabetes, again, know your numbers. So in terms of fasting blood sugar, if your blood sugar is less than 5.6, that's when we say fasting blood sugar, the first blood sugar that we will test before breakfast in the morning, we don't expect that blood sugar to be above 5.6. If it's above 5.6 to 6.9, we normally classify that as pre-diabetes. And if it is above 7, so this is not the random now, this is the fasting. So this is the sugar that we test first thing in the morning before we eat. All right, should not be greater than 7. Now, in terms of some symptoms that is associated with diabetes, with excessive thirst, in which we call polydipsia. Persons may have frequent urination, and some persons may feel excessively hungry. In more severe cases, we can have unexplained weight loss, could start to damage the eye to cause blurred vision, increased fatigue, and some persons may even have slow healing cuts and sores. Now, diabetes, likewise, hypertension, major risk factor again. So, second common cause of the major cardiovascular disease, stroke, heart attack, peripheral vascular disease, end-stage renal disease, you have peripheral neuropathy, diabetic foot, which is the leading cause of amputation. We have 3 specific eye conditions which can rapidly lead to blindness, such as glaucoma, cataract, and diabetic retinopathy. They're all severe complications of diabetes. And these are actually complications which arise when we ignore our diabetes. So we don't take our medication, we don't follow up with our doctor, and we don't have regular testing and monitoring for these. So a part of diabetes management when going to the doctor is not just so the medication. One of my colleagues would have mentioned that most important thing in managing chronic illness, even though we might stress that it's medication, it's not so much medication, but we need to be educated about these illness. We need to be monitoring the different values that we need to monitor. We need to follow up with our doctors, and diet, exercise, and the different aspects of management that would come into play with these chronic illnesses. So diabetes, hypertension is a high priority in men's health, even though it's common to both male and female. But why it's such a high priority when it comes down to men's health is that even though it's similar prevalence in male and female, far more males are dying from these conditions than female, and it just has to do with health-seeking behavior. Now we can look into some different other cause of death, is like different lung disease. And as I said before, some of the risk factor for lung disease, example of lung disease, such as COPD, normally are results of smoking. Some persons may have asthma, which is sometimes allergy or family related. In recent memory, we have COVID-19 as well, and like tuberculosis, which is still incident in Jamaica, is actually on the rise. Now, when we talk about lung disease, these lung disease normally increase the risk of developing lung cancer. All right. So if we talk about lung disease, we're talking about some symptoms such as most common probably is coughing. Then some persons can result in shortness of breath, but the infections may also result in fever, decreased appetite, running nose, sore throat. So the whole like flu-like symptoms are tend to be respiratory symptoms as well. And the bottom of the slide here, risk factor, tobacco, smoking, but it still have like the factories, the cars, the airplane, which have air pollutions that individual don't have much control over these stuff, because it would be at a government level to make policies in order to decrease the air pollution, etc. And like urban lifestyle tend to increase risk of air pollution. Now, in terms of cancer in male, I want to look at the diagram, because sometimes when we're discussing medicine, we want to look at leading cause of death, like the incidence, and how screening can help to minimize these cancer deaths. So even if the incidence is high, we talk about screening because we want to pick up on these cancers early, in the early stage they just can be cured. Now we know that, for example, in females, like you would see like females are more health conscious. So for example, breast cancer or cervical cancer, like females will be getting their regular mammogram, their regular pap smear when they come to the office, just as a health conscious person on the screening. We'll hardly ever see that type of behavior in male, especially Jamaican males. So you won't see Jamaican male tend to want to come and test their blood pressure if they are not sick, or to do their blood works, like their male executive profile, to do like, for example, their prostate specific antigen, to do ultrasound on the prostate. Even like males that are in the screening group for these illnesses tend not to come until something is wrong. So sometimes, for example, some male with prostate disease, I don't want to jump the gun too much in that. And so let's just flip along. So let's move into lung cancer. I think I have them listed out, so I don't want to spend too long on that slide, so I'm repeating myself, sorry. So in terms of lung cancer, some of the symptoms that persons may be looking for in lung cancer, especially those who are chronic smoker, is like chronic cough. Some persons may be coughing up blood, they may be short of breath, decreased appetite, etc. Generalized weakness for any cancer, significant weight loss is what we call a constitutional symptom, and can be a sign of non-specific for cancers in general. Risk factors for developing lung cancer: cigarette smoking, as I said several times before, but they also have lung disease, exposure to diesel, and sometimes persons that have a familial predisposition. So it's genetics in nature. Now, another cancer that I had said before earlier that is really a common cancer in male is colorectal cancer. And for recommended males above 40 years, we start to do the fecal occult blood. Some persons, if you have family history of colon cancer, they can start the fecal occult blood. So that is a part of the male executive profile. So some of these symptoms that I put here, like rectal bleeding, abdominal pain, blood in the stool, iron deficiency. These are normally symptoms of advanced or late stage colon cancer. So when we want to do the real screening for colon cancer, we do fecal occult blood or we do colonoscopy. So colonoscopy is actually when they use the camera to pass in the back passage and check the entire colon for any signs of cancer. This case can also not just be diagnostic, but sometimes it's used as therapeutic as well, in which they use it to remove any signs of small polyp that may be in the colon that may be precancerous in nature. Here are just some risk factors for colorectal cancer. So African persons of African descent, obesity, excessive alcohol and smoking use put you at increased risk. Inactivity, a diet that is high in in red meat or processed food. And as we get older, we know that the risk of all cancer increase as we age. Here, this slide show basically just showing the anatomy, just a general outline of the male reproductive organs. So we have the penis, we have the testicle here. Right in the middle here, we have the prostate, and we have the bladder, right? Now, prostate disease, we have three main types of prostate disease. So here we have a normal looking prostate, and we have prostatitis, which is inflammation of the prostate. So normally in young males, we tend to have young males will develop prostatitis as associated with like sexually transmitted infections such as chlamydia, gonorrhea, etc. Birds can have complications of prostatitis. However, in older men, like normally 50 and above, we tend to develop what we call BPH, that is benign prostatic hyperplasia. So the prostate gland, as I showed on the previous slide, is actually a walnut-sized gland between the bladder and the penis. But what happened with the prostate is that it keeps growing throughout life. So it's not like it's an organ which have a gland which has just one side and it stays like that. It constantly get larger throughout life and tend to compress the tube, which is the urethra, which take the urine from the bladder to the outside, and they develop symptoms which have urinary issues. So the digital rectal examination is a vital test in male. However, it's one of those tests that is most deferred in my experience as a clinician. So even when we explain the essential of doing a digital rectal examination by inserting a glove finger in the back passage to feel for the prostate, it's gonna most often than not be a no-no for a Jamaican, right? And it's understandable, but even if the male should not shy away from a doctor's visit because they don't want to do digital rectal examination. I'm just trying to use this medium to inform you that even though it's recommended that the DRE is done, we also have additional tests which test for prostate disease. So we have the prostate specific antigen, which is the PSA, which can detect prostate cancer, right? Because it normally secretes the prostate specific antigen, and if the value is extremely high, then it's an indication of prostate cancer, and we could then go ahead and do the biopsy to confirm it. We also do prostate ultrasound, in which we look at the shape and the size of the prostate, etc. And it can also, even though it's user dependent, it can give an indication of prostate cancer as well. And then in those cases, normally if we have abnormal PSA, then we find out that the male tend to be more receptive of doing these examination and evaluation, because then the reality will hit them that, oh, it's a chance that they might have prostate cancer, so they tend to shy away from that. So even if you don't agree with this examination and normally don't be hard on the patient, I will normally just advise them about the alternatives and to make life still a worldwide checkup for them. All right, so risk factors for prostate cancer: older age, as I said before, ethnicity. So African descent have a higher incidence of prostate cancer. Also, family history. And research suggests a link between obesity and many cancers, including prostate cancer. And this slide is just showing like some symptoms of advanced prostate cancer, which can also include erectile dysfunction, which we will get into shortly. Now, testicular cancer, even though it's not a cancer that is readily in the media like prostate cancer, it's actually one of those cancer that can actually be detected at an early stage as well. So similar in females, we ask females to examine their breasts. We also advise males to examine their testicle, right? So they know how it feel, know the consistency, the size, etc. Because in terms of symptoms of prostate cancer, in terms of what they could identify, sometimes the shape of the testicle may change, sometimes the size may shape, sometimes they might feel a lump on the testicle. So similar examination, which you would encourage a patient to examine their breast, would encourage male to examine their testicle and be familiar. So if any abnormal change occur in terms of size or lump or irregularity, then they would be familiar with it. Now we can move into more specific male problem, not so much the cause of what should I say now, decreased life expectancy, but we know how important a male penis is to their manlyhood, right? So some males, if they have erectile dysfunction, it can lead to a wide range of mental health problem and relationship issues, and because men like to feel like dominant person and masculine, and sexuality is also a big aspect of that for male, right? But especially in this time when a lot of females becoming independent of their own independence, so they have their own income, their job, etc., and they're fully independent. Some males might come to my office and feel that, oh, the only reason that their partner might be attached to them is because of sexual activity. So you can just imagine if they have erectile dysfunction, then that could change a lot in terms of the whole relationship and their mental health. Now, some of the causes of erectile dysfunction, we have pelvic floor dysfunction, and we also have obesity, cardiovascular issues, and diabetes. So these are common causes. So hypertension, diabetes, these are actually common cause for erectile dysfunction. Some medications as well may lead to erectile dysfunction. All right. And additional cause is here. Oh, as I said before, is a repetition. Oh, sorry. So additional causes like smoking, drinking, alcohol are actually risk factors for erectile dysfunction. So even though drinking, smoking is actually habit that men claim that they use to reduce stress or to enjoy themselves, it's actually very dangerous when it comes to the sexual health of a male, right? Sometimes other causes, sometimes erectile dysfunction doesn't necessarily have to be biological cause. Sometimes it's just psychological cause, in which excessive stress, depression, or poor relationship interaction may lead to. So sometimes not necessarily a medical doctor they need to see, so to speak, but actually a psychologist. However, for erectile dysfunction, we have treatment for erectile dysfunction. Some may be medication, while some may be actually surgical treatment or other devices, mainly managed by a urologist. All right, but just to hear, just to make a point here that you can ask if a person have erectile dysfunction, they could ask about some stem cell therapy, could ask about the vacuum erection device, they might ask about low intensity shock wave and penile prosthesis. So these are some of the stuff that I just want to take from here that you can go and ask your healthcare provider about these options. Another issue with sexual function that some males will basically be suffering from is premature ejaculation. As I said before, sexual health is very important for male, and premature ejaculation also is one of those conditions which men seek medical attention for. And symptoms of premature ejaculation: lack of control, weakness. Some may have it may lead to embarrassment. Some may have mental stress, and some may have decreased sexual pleasure, and leads to all type of relationship issues as well. All right, so we're not going to take another lengthy presentation, but I really have to move into sexually transmitted infections. And example of sexually transmitted infections are chlamydia, gonorrhea. We have herpes, hepatitis, trichomoniasis, but we have HIV and syphilis, which are actually two of those chronic STDs that actually may stay with the individual for the rest of their life and cause serious complications, right? But in general, even chlamydia, gonorrhea, and stuff can lead to infertility and urethral stricture, which can lead to all type of different medical problems within male, right? Now, in terms of risk factors for HIV and other STDs, we see that not using a condom is actually one of those risk factors. Younger persons between age 15 and 24 are also at increased risk. Persons with multiple sexual partner also at increased risk. Again, alcohol and drug abuse is at increased risk, because as you would know, some persons that drink sometimes tend to not be in their right mind and then indulge in these unhealthy sexual practices, which can lead to that. Now, we list several issues that men can face. And I'd mentioned earlier that some of these issues would basically result in affecting a man's mental health. So what I wanted to do here today is, because male tend not to be open and want to discuss mental health in public, because it's normally we feel like it's a sign of being weak, and it's like discriminating in a sense for a male. But if you have your brother, your sister, your brother, your spouse, your uncle, any male, and you see some of these signs, then you could actually talk to them and encourage them that they may need to seek help in terms of their mental health. So if you see someone becoming increased irritability, so they get quick to anger and frustration, it could be a sign of poor mental health. If they become social, avoiding social interaction sometimes are signs of mental health challenges. Some persons may maybe not getting enough sleep, trouble sleeping, or they may be sleeping too much. Some persons may have physical symptoms such as headache, fatigue, and body ache because of poor mental health. And loss of interest in activities that they normally take part in, substance use, and negative thoughts. So sometimes a person may start with drinking and smoking a lot, and it's just basically a mental health issue that they're having, and not necessarily that they're actually addicted to these substances, but it's just because of mental health. This slide just basically showing some research that was done, like a questionnaire basically, in which they had asked about 1,000 men what they said about their mental health. And the biggest cause of mental health issues in men's life are, they blame it on work. Pressure was 32%, financial issues 31%, and their health was 23%. So as you can see that work pressure and financial issues basically account for about 60% of the cause of mental health issues in male. 40% of these men said that it would take, they have thoughts of suicide or self-harm to compel them to seek professional help. And the 40% have never really spoken about their mental health. And 29% of that would be too embarrassed to speak about it, and 20% say that a negative stigma is associated with it. And 77% have suffered with symptoms of negative mental health. So mental health issues really in male, and we need to put more effort into it. So some stuff from this presentation that I really want men to stop these stuff immediately. Need to man up, and boys, do not cry, deal with it. So you are being too sensitive. Some of these phrases you should really stop immediately and try to actually be open about men's mental health. All right, so final slide, just to give a summary or some tips about men's mental health. So as I said before, you should stay active, eat well, know your numbers for a person with diabetes, hypertension, obesity, BMI numbers, even though I didn't really give the BMI, but in general, healthy BMI is between 18 and 25. Stay hydrated, drink plenty of water, prioritize mental health and talk about it as much as possible, and seek counseling and help where required. Limit the amount of alcohol, avoid smoking or quit smoking if you are currently smoking. If you currently smoke, and this should lead to a better lifestyle. And regular checkups general is essential to check blood pressure. So as early as teens or 20s, you need to be checking your vitals, blood pressure, blood sugar, etc. As you get older, then the doctor will guide you according to other tests that you may need, like the executive profile, colonoscopy, prostate examination, etc. And this concludes the end of my presentation. Thank you.
Yes, sir. Thank you very much.
Okay, thank you.
Thank you very much. Ladies and gentlemen, once again, I want to welcome to our midst here the Elam Gospel Assembly Men's Group. They have joined us in group from one location. Gentlemen, welcome for joining us. Dr. Samuels, that was a most informative thing. We got a couple questions that we got to talk through, and I would like us to kind of just have a little candid discussion on men and our own psyche and where we go. But before we jump in here, just want to remind everybody that we're coming up to World Suicide Prevention Month here in September. So we'll have a seminar. There's a prayer meeting series kicking off every Wednesday, 7:30 to 8:30 each Wednesday. So make sure that you tap in. There is a Zoom. If you're not on our email list or WhatsApp group, please just share on here your email information, and we'll make sure we add that, or your phone number, so we can get you. Dr. Samuels, you're still sharing your screen. I think if you, yeah.
Okay.
And share here. Luke, do we have any further announcements we want to talk about? Every week we have this webinar, usually between 5 and 6 and 6:15.
Thank you.
I'm just going to give a little space for Luke here to kind of share some more if needed.
Thank you, Sir Martin. Wow, what a comprehensive, informative presentation by Dr. Jevon Samuels. It's really eye-opener, revealing, and wow, we could be listening to this all afternoon. Thanks again, Dr. Samuel. And just some reminders, coming for our who notices. Uh, Webinar next week will be as we continue to focus on stronger relationship. Our youths will be on next week, and you don't want to miss this as we are focusing on youth as we bring this month to a close next week. And so we have to be part of this as we proceed coming up. Please be a part of this. As Sir Martin mentioned, our CLI prayer meetings starting this Wednesday will be every Wednesday leading up to our World Suicide Prevention Day seminar, which is held on September 10th. And as we zero in on this day coming up in September, and we want everyone to be part of this every Wednesday, we're using the same link, and we want you to be part of this prayer meeting going forward, starting this Wednesday and every Wednesday, God's willing, leading up to our World Suicide Prevention Day. Please pray, promote, and seek to participate in this venture. If anybody wants to sponsor or to contribute any way to the seminar, and you want to volunteer, you want to be a part of this tremendous seminar coming up forward, you can get in touch with Dr. Donovan or Faith Thomas, or you could call the CLI office and let your request be made known. We also want to remind you that come July, the webinar will be, the emphasis is going to be summer vibes. Yes, summer vibes. As we're looking on rest and relaxation. And webinar number 346 coming up in July. We're looking at budget-friendly vacations, hotels, and as we want to. And I want to be at that one because I want to see how I can get a good bargain and deal for my wife and myself and family so we can rest and relax. And I'm recommending this also for Dr. Donovan and Faith Thomas to make sure this summer vibes you get some relaxation as we have been working tremendously hard. And I just want to pause to encourage us that we be praying for Dr. Donovan's brother, Byron, who has been going through challenging times. But the good news is that God has been working on his behalf, our behalf. And I want to encourage you to be praying for him. He has done 2 surgeries already. God has brought him through both of them, and we are believing God to do a work as we are looking at his health. We're trusting that the God of all miracles and the greatest surgeon ever, the Lord Jesus Christ, will take Byron through these challenges that he is facing. Sir Martin, back to you as we listen for the questions. Don't forget to put your comments and ask your questions in the chat as we proceed. God bless you. Over to you, Sir Martin.
All right, Dr. Samuels, we're going to jump right in on the back here. You talked about it. Most important question. Is there any correlation between diabetes and sperm quality?
Right. The diabetes is a metabolic disease, so it damages basically all the organs in the body, which includes the testicles and the seminal vesicles and the prostate. So in essence, yes, it does have a little factor with decreased sperm quality, decreased sperm count, erectile dysfunction. All the dysfunctions of male sexual organs can be attributed to diabetes. And it also would affect the nerves, the autonomic nervous system, which controls sexual function as well. So even indirectly, it does.
So is there any truth to an increase in prostate cancer developing at an earlier age, such as in the 40s?
Yes. In recent times, prostate cancer as well as colon cancer, we are seeing a increased incidence in younger persons. So it's not uncommon because, as we said before, like we have other risk factors for prostate cancer. It's not just old age, but alcohol use, smoking, some STI may lead to increased risk of prostate cancer. So yes, definitely some persons, because of screening, we are picking up prostate cancer at younger ages in some persons. So the
So,
incidence is actually increasing.
so you mentioned that a little bit earlier here. Same thing with diabetes and cancer. I think this is your second slide was probably the most critical. What should a man do and be very careful of and focus on lifestyle wise in order to not get to that stage?
Prostate cancer.
Yeah, anything, just general health. It's lifestyle. Are there things that we can focus on more so, especially when it comes to prostate cancer, diabetes?
All right, as I said before, the second slide says it all, it's lifestyle changes. So we're talking about getting adequate sleep, having a balanced diet. So it's a diet that is high in fruits, vegetables, and whole food, and less in processed food, refined food, and cease the cessation of smoking, drinking less, and general exercise and active will actually reduce obesity and some of those other risk factors. If some person have a balanced diet and exercise, will tend to reduce the risk of those stuff. And not to make mention, as I said before, general checkup in general would actually involve getting counseling about BMI. If you BMI getting a little high, so if you're getting overweight, at least the doctor could actually show you where you are and the amount of weight that you need to lose and make some advice. Sometimes they may refer persons to dietitians, etc., to help with their meals if they're seeing that the person is struggling with their diet. Some may recommend gym and our personal trainer. Even if a person can't afford gym, they can. It's modern time. We have the internet readily available. They have exercise that they can do at home. Some of these gym equipment is becoming available, so they could actually use them and do it at home as well. So there is really no excuse to not being physically active because the things are there available and the evidence is there that exercise, diet, enough sleep is actually essential for good health.
Okay. Yeah, that's cool. So how often should a guy go to the doctor? Once a year, once every 6 months?
It's advised that a general checkup is normally depending on the age and the health condition of the person in general. So it's not a one size fit all in this case. But in general, for a male, a healthy male in their 20s, they expect every year to every 2 years they should make health checks. If the person have a chronic illness that needs monitoring, maybe 3, 4, 5, 6, 7 times per year. If a person like have, for example, severe hypertension or diabetes or kidney problem, will vary from person to person. Some of these persons need regular medical checkup and monitoring in general. So it varies depending on the health condition of the person and the age.
Okay. Is the rectal examination able to detect prostate cancer earlier than the PSA? Or do you recommend PSA over the rectal for annual check?
All right, that's a good question, but I recommend both of them. Reason being, the digital rectal examination, as we have shown you on the diagram with the prostate, some depending on the aspect of the prostate that the cancer is, sometimes it's at the front aspect of the prostate, then obviously we won't be able to feel that roughness on the prostate and digital rectal examination. So that is where, in that case, maybe the PSA would be more sensitive in those areas. So both of them is recommended equally because depends on where on the prostate the cancer is. We may have the DRE is more sensitive than the PSA, or the PSA may be more sensitive than the DRE.
Okay. What's the underlying cause for African descendants, black males, being more susceptible to prostate cancer? Is it hereditary or just based on lifestyle?
It's likely hereditary. Likely hereditary. Because lifestyle, if it's a case with lifestyle, we still have persons of different race would have similar lifestyle practices, and it would still have a higher incident in African Americans. So it's most likely when we do these tests and it's specific to a race, it's likely genetically related or environmentally related.
All right, let's get a little bit now into modern technology. You talked about for the mental health of the male. We don't like to talk about it. We don't like to go to the doctor. We don't want anybody to sticking their finger in certain places. So technology is now bringing a lot of doctors on our phones, okay?
Yes.
What do you talk to about checking AI, doing the self-diagnosis? What are some of the intrinsic risk of us doing that versus really seeing a medical professional?
Okay. All right. The issue with medicine is that symptoms can be similar for different diseases. So, for example, a person may have, let's just look at the prostate for using prostate as an example. Some of the symptoms for prostate cancer may be similar to a non-benign prostate problem, such as BPH, enlarged prostate. So if the person should go on AI and read the symptoms of enlarged symptoms that they're having and thinking that this must be enlarged prostate, they will be probably making the biggest mistake of their lives. So what we do in medicine is that physicians are trained to come up with a differential diagnosis, and after these symptoms, we would normally do the vitals, we do blood works, and we do different imaging such as ultrasound, CT, MRI to actually come up with the most that likely are the accurate diagnosis. Because sometimes, for example, seeing the prostate, even with the PSA values and the DRE and the ultrasound, the definitive diagnosis of prostate cancer will still be made with a biopsy. So we still sometimes have to take a sample of the prostate or the different organ in question to determine the exact diagnosis and the way we treat.
Mm-hmm. Yes, 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 yes. What can be done for persons who have diabetes other than consistent pharmaceutical prescriptions?
All right. Diabetes is one of those. We have two different types. We have type 1 diabetes and we have type 2. In type 1, the issue is that the pancreas that makes the insulin is not making any insulin whatsoever. In those cases, there is not an alternative that we can use but to give the insulin therapy in those cases. For type 2 diabetes cases, however, depending on the severity, some persons' blood sugar or condition may be regulated with weight loss, exercise, and proper diet. However, this is not a one general answer for everyone. It has to be done on a case-by-case basis and a patient-by-patient basis. So it would still have to be something that you have to discuss with your doctor to monitor if you're able to come off these medications. I know that some persons state that they have alternative medicines, herbs, etc. But because I wasn't trained to do with the herbal medicine, I don't want to comment much on the alternatives to the medication. The only alternative I can comment on for persons who have like mild diabetes is diet, weight loss, exercise, and rest. Those stuff normally increase the person's diabetes state.
Yes, yes, yes. Move is one of the things. Talking through cancer screening, is there a recommended age when I think you kind of showed it on your graph?
Yes.
But let's just kind of say it out. When I have hit this age, I now need to be starting to talk about cancer screening. 40, 50?
All right. So in general, most cancer will start to screen at age 50. However, we have certain exceptions. Say, for example, you have a family member that was diagnosed with like colon cancer at age 30, or your brother was diagnosed with colon cancer at age 30. that patient should come to us from age 15 or 10. We might start to do like genetic testing or start recommend their colonoscopy from their 20 or 15, right? Also, some condition like inflammatory bowel disease might put you at increased risk of developing colon cancer. So in those patients would screen them, do the fecal occult blood and the screening colonoscopy at an earlier age. So it's not necessarily a one age for everyone. It depends on the personal family history and previous histories as well.
So we need to get out of the I am not old enough, but my conditions might predispose me, so let me go check.
Definitely.
Yes. Let's switch gears and talk about this mental health. How do we overcome this masculine, I don't want to talk about mental health, I just want to suck it up? Are there inroads being made in terms of to counseling or activities, or where do we go?
All right. Mental health is a complicated issue, and I think we have to take a public health approach, probably similar to like what was done with like seat belts or like smoking. It has to be a public health. It has to be a process in which it's publicized in the media by the government and public health, and actually have persons to come in to actually have these seminars in schools, etc. So we can actually have a change in the culture of the awareness, public awareness in general.
Yeah. Would you have any advice for let's say parents of the young males, okay? Because one of the things that we get to is this man up, right? And don't talk about it, suck it in, keep it in. There are fathers on this table. What advice would you give them as they're interacting with those around them who are younger to kind of begin to overcome this stigma?
Well, my advice would to actually discuss the statistics with them and use like examples and show like persons who actually end up at a poor outcome because of some of these behavior. So like we would end up like be surprised when we hear of someone commit suicide, like a male commit suicide, or they become violent, or they start to smoke, they start to drink, etc. And we would just use like some persons as example to show what would have caused like the like lack of owning up to like mental health issues and talking about it would have actually cost the lives of some persons or poor behavior, sometime becoming a part of gang violence and end up incarcerated, etc. So I would just take and use that approach to encourage when we are using when we are speaking to younger persons. We normally just use like probably example of persons that they would be around and probably relate to them.
Cool. Yeah. Yeah, I think definitely, it's something that we really have to start addressing head on as far as the men on this group.
Definitely.
Dr. Samuels, thank you very much. It has been a real good pleasure hearing you unpack. Just so everybody knows, there's a lot of content in the presentation. This will be online on YouTube. Okay, if you go to the Choose Life International YouTube site, you will be able to see this presentation, this whole webinar, as well as the other 343 webinars that have been done over the last couple of years. So you can go back and slow it down, really digest the slides. There's a lot of good information in there, but unfortunately you can't spend forever talking about one slide. So it's all of that stuff. One last question popping in here. Why does diabetes impact so many other organs of the body?
All right. The answer to that definitely is that diabetes is actually a metabolic disease. So it's a vascular disease that affects the blood vessels. And as if you would have known the anatomy of the body, is that the blood vessels basically interconnect all the different organs of the body. So if we are damaging the blood vessels, we eventually would damage the organs that are close to the blood vessels. That's actually the basic explanation for that.
Yeah, because the long and short of it really is our body's a series of blood vessels and nerves, and they go
Yes,
everywhere.
definitely,
And the minute you've got any kind of restriction on any of them, then all hell starts to break loose, right?
definitely.
Yeah, and something we don't really understand why a pain in the foot could be something dealing with your head or wherever. Yes. Yeah, Dr. Samuels, we really, okay. More questions are popping in. Let's jump into them.
Okay,
So we had somebody from Uganda actually saying, giving thanks for this, okay?
okay, sure,
Is
definitely.
there any study on PTSD and the correlation to the fatherless and crime? Ooh, that's a whole wide topic right there in itself.
Yes, I would not have that information at hand, but I'm certain that there are studies for everything. But I don't have that information readily for this presentation. All right, but I could, if you take my contact information, I could do some research and probably share that information at a later date because it's actually an interesting question, but I'm just not equipped with the statistics and the research at this point.
Yeah, but I think the short answer is yes, right?
Okay, yes, most likely a research. Yes, a
Yeah, there
research
is
for everything. Yes, sir.
strong correlation between them. Yeah. Now, Miriam is advising for those of us who don't necessarily want to go to a doctor. It's in the chat. You folks can look at it, but there are women urologists in Jamaica. Okay, and so
Definitely,
you can check out that if you're not comfortable going to a male. But
definitely.
Dr. Jevon Samuels, you have been most gracious, most informative. Thank you very much for really taking the time to prepare this presentation and going through with the level of detail that you have. Really appreciate it. Mr. Moderator General, Stephen, I hand over to you.
Thank
Sorry,
you.
Luke.
That's all right. That's fine. Thanks again to Dr. Jevon Samuels, medical doctor in internal medicine at the Kingston Public Hospital. Thank you, sir, for this comprehensive, informative, detailed presentation. And looking forward again to reflect on it in the YouTube channel. Thanks again. Thanks again to Sir Christopher. Wow, you just keep growing and blossoming with the age, my brother. And you have so much information there for you. And you sound almost like you're an assistant doctor there based on what I hear you doing. Thank you, Sir Chris. Appreciate it. Next week, again, I'm reminding you, webinar 345, we continue with our theme, Stronger Together, Building Healthy Relationships. The focus will be on our bright, brilliant youths. Moderator will be our sister Marcy Augusti. So let us bear this in mind as we reflect on it. And again, come July, we're looking at rest and relaxation. Thanks again to all who are here. Thanks to the men, and a special thanks to the group from the Elim Gospel Assembly for joining with us. And let us take our health intact. And I myself, Dr. Jevon, has been taking a serious step looking at my own health in reflecting and growing. Thanks again to all those who are here. Let me just have a pause for a word of prayer. Father God, we give you thanks for your greatness, for your mercy, for your love towards us. Thank you that you're the sovereign God, that you are in control of our lives. You're reminding us this afternoon that our bodies are the temple of the Holy Spirit, and hence, as men especially, we should take good care. Thanks for the reminder through your servant, Dr. Jevon Samuels. And I pray that we will take steps, take action to address our health, physical and mental. Thanks again for Sir Christopher Martin, Lord, who you're using. Continue to bless him. The men on board, pray, bless the men, bless everyone, the ladies and gentlemen who are online. Thanks for those who keep coming time and time again, our board members, staff members of CLI. We thank you, God, for each. Above all, we give you praise and glory. You, the sovereign God, who rules and reign in the affairs of men. We also commit Dr. Thomas Donovan's brother Byron to you, that you'll continue the process, God, in his life, for your praise and for your glory. As we say, to God be the glory, great things he has done. Amen and amen.
Amen.
God bless your friends. We are there at the time when we are
Counting down.
counting down. And as we count down, we're going to ask that you get our hands up as we count from 5, 4, 3, 2, 1. And one of these days, it is going to be the final countdown as our Lord can come anytime. And who to tell if it is going to be this week? We're not sure. Let's get our hands up now as we prepare to count down, please. Let's all the bright people from the Caribbean and from Trinidad. I know my friend Vanetta is there. Let us go. Let us go. After 2, 1, 2, 5,
5,
4,
4, 3,
3, 2,
2,
1.
1.